are the considerations when choosing treatment for advanced prostate cancer?
Well, here, the considerations in advanced prostate cancer are, first and foremost, what is the best treatment for this particular individual, right? That's what we want to do. And by the best treatment, I mean most effective with the fewest side effects, protecting their quality of life. But that's an oversimplification. In reality, to arrive at what the best treatment is, we need to really understand quite a bit about the patient's cancer. Sometimes it's mutational status, as we discussed earlier, but also the way it's presenting, how aggressively it's growing. Is it involving the liver or lungs, or is it only in the bones? Is it fast? Is it slow? And then the other thing that is extremely important is the patient's health, other medical conditions. Some treatments are really more difficult to give when somebody has cardiovascular disease or diabetes or nerve damage for other causes pre-existing to the cancer treatment. So those kinds of things, which we call comorbidities in the medical arena, are really important in refining the risk-benefit ratio for each treatment. And finally, and critically, what prior treatments patients have received. That's a major consideration. We obviously wouldn't be using the same treatments again in many patients. There are exceptions to that, but for the most part, if a treatment's failed once, it's not likely to be of great benefit. So we integrate the cancer presentation, perhaps genomics in some situations, patients' specific health conditions, patients' prior treatments, and then, of course, patients' values and personal priorities and what's most important to them. And from all of that information, we take a look at the available portfolio and suggest one or two options, which we as physicians, based on our experience, expertise, and the knowledge of the literature, believe that fit most closely and are most likely to be successful.
What is the role of the patient in making treatment decisions?
Well, I think that the role of the patient is absolutely critical. I mean, they're the ones receiving the therapy. And there are many things that we look for from our patients. To me, the most important is a clear understanding of their options and the reality within which we operate, having a set of hopes that are forward-looking, hopeful, and optimistic, but also grounded in reality so that good decisions can be made based on reasonable expectations. Number two, a clear and honest articulation of the priorities. And that can be difficult. Sometimes it's hard to balance priorities. We would obviously want to live as long as possible with a good quality of life. Mm-hmm. But what if the choice is better quality of life with a shorter lifespan, or a longer lifespan but more side effects? And that's really hard to sort out for some folks. And, in my experience as a physician in the trenches, I can also tell you that sometimes the goals of the patients and the goals of their loving spouses and families are a little different. And trying to help us, as physicians, our primary responsibility is to address the patient's goals. But we all know that what we really want for our patients is a consensus of all the people they love that are important to them, so that everyone can be supportive and on the same team. Yeah. Those differences can be really stressful. So another thing that I look for in my patients and try to help with is building a family and friends support network that's aligned, that's on the same team, really. And then, really strong communication with the physician or the provider about how things are going, letting us know about side effects honestly. That many people do that, but some people are afraid to share side effects for fear that their treatment might be taken away. That honest, straightforward communication is really important for for the best decision making. So, and then, of course, knowledge about the treatments and understanding of what we're talking about is helpful. But actually, to me, it's not the most important thing. Having read the detailed papers on docetaxel chemotherapy, while helpful, is not as important as having a really clear understanding of one's values and priorities, and a candid assessment of one's quality of life, and the ability to share that with the physician. I can cover the technical medical stuff, but what I can't do is guess what's important to my patients.